Pastor Chooks, along with his wife, Pastor Toyin, are the lead pastors of Resurrection Life Church in Johannesburg, South Africa. Through them, God is raising an army of ordinary men and women who are transforming and uplifting the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation and uplifting of the complete man, complete woman, and wholesome families. Some of the events and programs include the Dream Achievers seminars and conferences, Kingdom Financiers conferences, marriage enrichment courses and seminars, for wives-only seminars, single ladies boot camps, limitless men's seminars. They are also the founders of the Power of Woman Academy, a group mentorship for high-impact women. They also host the annual Power of Woman conferences and events. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Welcome to another episode of the Amazing Power of Woman broadcast. My name is Toyin Ugohe, and with me is Pastor Chooks Obina Ugohe. And together we are your hosts for the Amazing Power of Woman broadcast. And we come to you every Thursday evening, 7 p.m. South African time. And we have an exciting episode for you this week. This whole broadcast is born out of this book, The Amazing Power of Woman, written by Pastor Chooks. And he's going to tell you a little bit about it again. But this book is what informs this broadcast. And we have a program every Thursday at 7 p.m. and we just bring to you wisdom from the Word of God regarding the woman. And what this ministry, this broadcast speaks to the woman in her three spheres: her body, her soul, and her spirit. And we minister in those three realms. And once a month, we have what we call our Ask Your Gynae, which is specifically dedicated to speaking to the body of the woman to help us understand more about the body of a woman. And so this Thursday, today we're having the Ask Your Gynae session. It's the last Thursday of every month. We're having our Ask Your Gynae session. I'm going to hand over to Pastor Chooks to just talk a bit more about the book and about Ask Your Gynae.
Well, welcome ladies, welcome gentlemen, anyone who's joining us. If tonight is your first time joining us, we hang out around the Amazing Power of Woman every Thursday. Like my wife has just said, we share revelation from the Word of God to empower the woman in her spirit, in her soul, and in her body. Yeah. We discovered over many years quite a bit of information from the Word of God that speaks to the power that God has put inside of the woman. And we know that that power comes out from her spirit, comes out from her soul, also from her body. So we need to look after her spirit, her soul, and her body, and empower her in those three dimensions in order for her to maximize the deployment of the power that God has given to her. Amen. So tonight, like my wife said, we are doing the body. Ask Your Gynae session is what we have tonight, and we are discussing a very important topic that a lot of women battle with. And the topic tonight is on fibroids, demystifying fibroids. Yeah. And we have one of our gynecologists on tonight with us, live here in studio. Yes. She's going to be sharing on fibroids. You know, what is it? What does it do? How do we get rid of it? How do we sort it out? What are the medical options available? What does any woman need to do? Can it be prevented? Can it not be prevented? I'm leaving that to the gynecologist to talk about tonight. But welcome. This is your opportunity to share this broadcast with every woman around you and with every man who loves any woman. Yes. Yeah? Because we all need this information. There is a lot of suffering. There is a lot of pain around fibroids. And if we can demystify fibroids, then we can reduce the suffering that a lot of women are going through because of this. All right, so tonight we are hosting one of our gynecologists, Dr. Audrey Gugu Gametse. She is not a stranger on this show. She will be the one helping us to unpack the issue of fibroids. Anything before we bring on Dr. Gametse?
We will just go on an ad break. But if you have questions around it, please feel free to write your questions on the stream, either on Facebook, on YouTube. Just write your questions, and we will collate those questions and see how we can possibly have another session where we can answer those questions.
Yes.
There will purely be a Q&A. We'll get you more information at the end of this broadcast, what we want to do, whether we're going to have it next month or we're going to have a special session specifically around fibroids, and we're going to be able to answer those questions. So if you have questions, kindly put those questions on the stream.
Yes.
And if you want to, if it's going to be private, we'll make another you have the phone number on the screen, plus 2781 4210835. You can send us an anonymous question on the WhatsApp. It's a WhatsApp number. Send us a question around fibroids, something that has been an issue and you just want to get clarification. What we want to do today is shed light on it. There's so much mystery or misunderstanding or lack of knowledge around fibroids, and we want to bring information regarding that.
Accurate information.
Yes. And so we're going to relax. We're going to be a teaching for today, and if you have your questions, we're going to have a Q&A sometime, and we'll let you know about that. Thank you. Just after the ad break, we're going to have Dr. Gugu Gamedze.
All right.
Thank you, and God bless.
All right. So for those who are new to our show, Dr. Gamedze is a practicing specialist obstetrician and gynecologist who has a practice here in the city of Johannesburg, South Africa. She is our guest tonight, our guest doctor, and she's the one who's going to be teaching on fibroids. So after the ad break, you are going to hear and see the face of Dr. Gugu Gamedze in studio. Well, God bless you. We'll see you just now.
The Power of Woman Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Woman Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za, or for inquiries, call 064 200 1545.
Good evening, viewers. Good evening, listeners. Thank you so much, Pastor Chooks. Thank you, Pastor Toyin. And thank you to Power of Woman. Amazing, amazing Power of Woman. It's a pleasure again to welcome me, Dr. Gugu Gamedze. I am an obstetrician gynecologist practicing in private, and I love women. The reason for me being here today is again to bring insight and enlightenment to us women about fibroids. Fibroids, all the things that I hear. That's very much interesting to give and shed light about what are fibroids and what can they do to a woman, and why is it important that as women we know fibroids and we know the impact they can have in our health, in our community, and also in our spirituality. It is amazing to know that if we do not get empowered, we easily slip by. I was actually taken aback into scripture when our greatest gynecologist, Jesus Christ himself, healed a woman who had 12 years of bleeding. I'm thinking that most likely this girl might have fibroids because she bled and did not die. If it was cancer, I'm thinking 12 years, she should have started showing some signs that there is a serious problem here. But if it was fibroids, most likely that is why she bled for such a long time. Anyway, the master himself will tell us what did he heal this woman of apart from the bleeding. Anyway, to start off with, every scientific approach starts with a definition. We'll look at what are fibroids, what causes fibroids, and what symptoms must I be looking out for. If there is any treatment, what are the treatment options that I have? Complications, do fibroids have complications? What is it that I need to be aware of? Okay, let's put things into perspective. What are fibroids? Fibroids are like growth that happen in the woman's womb. They are mostly confined to the womb, but we do get some that are, we call them ectopic, whereby now they move into tissues that are far from the womb. A relative to that one will be a fibroadenoma, which is found in the breast. By the way, it doesn't mean that if you've got those lumps in the breast, you will have them in the womb. But I'm just talking about relatives of how fibroids can be distributed in our body. So the commonest place where they affect us as women, it is when they are in the womb. What are the causes? We do not know what caused them. In medicine, once we have a long list of causes or associations, we do not know what is the cause. So the main thing that the main association where we find fibroids, it will be women of obesity. It will be women who started their periods very early. It will be women who have a family history of fibroids. It will also be women who have started their families a little bit late. But all of these are associations. When we do immunological studies, which is what I do not want to dwell in, there is an association with certain components or certain chemicals that which, when they are found in the woman, they are most likely going to cause the woman to have what we call fibroids. Apologies for that. So now, what are we going to put as the symptom profile for fibroids? Most of us do not know when we have fibroids or not. But what we commonly see is that somebody is going to present with pains. Pains can be associated with your periods. They can be associated with nothing else. They just come on their own. Secondly, somebody can present with heavy period pains or heavy period flow. The heavy period flow is associated with the period itself or even outside the period, depending on the intensity or on the severity of the fibroids. One can have heavy bleeding during the periods or heavy bleeding outside the periods. The other thing that we see is difficulty falling pregnant. That can be one of the symptoms or the presentations of fibroids. You try to fall pregnant, you take everything that needs to be taken, but still you fail to fall pregnant. Other ladies present with just intractable pain. You have this heaviness in your pelvis. Sometimes you are even constipated. On other times you are even struggling with intimacy for those who are married. I have seen a common presentation where ladies come with growth of the abdomen. That will be outside pregnancy. Even sometimes when you cannot feel the fibroids, but still you find that the abdomen or the tummy is just growing big. So those are some of the symptoms that present with fibroids. But on the womb, where are these fibroids positioned? So the structure of the womb is such that it has got the mouth, which is the cervix. It has the neck, which is the isthmus. It has the body. And on the body, you also have what we call the fundus, or that's the highest point of the womb. So on the womb, you can have fibroids on the cervix. The ones on the cervix, because the cervix is the one that takes the weight of gravity, oftentimes you find that they find their way out and sneak through the mouth of the womb and even check through. Those are the ones we call prolapsing. The commonest presentation with those, it will be pain. Somebody will feel like something is coming out or coming down, or pain like contractions. Those who have had children before will know how painful contractions are. And also they can present with bleeding. Sometimes if you are intimate, you see the bleeding coming through. So with those, the presentation is much easier. But sometimes they don't present with the bleeding, they just present with smell. Somebody can feel like my smell is a little bit more on the offensive side, or I can't just get myself clean. So that will be one of the presentation of fibroids. If it is on the body of the womb, depending on how far it is from the lining of the womb, it cannot present with bleeding if it is far into the muscle of the womb, but it can just present with discomfort. Hence, sometimes somebody grows fibroids and doesn't know that they are there because they don't give any problems. I've seen that more commonly with the women in the house of the Lord, where you find that you have preserved yourself, you're not sexually active, you're not having heavy bleeding or any gynecological issues, but one day you see your tummy growing big, and when you check, you find that you've got fibroids. You wonder, but how come I didn't know? How come these things have grown so much? It's because they were not symptomatic. And then if now they are growing on the outer part of the womb, they normally develop on some small branches. They will literally look like, say, avocats on the tree, or like fruits hanging on a tree. We call those pedunculated fibroids. When you have that type of fibroid, it can just sit nicely inside the tummy and keep growing, nourishing itself. If it is very clever, it can even like attract some blood supply from the surrounding intestines and continue to nourish itself. Those ones rarely give discomfort, but if they do, it will be because they will have grown so big now, they are giving you weight, or they are pressing on the structures that are found inside your tummy. So now you have had this diagnosis, or you think that you have fibroids. What needs to be done now? What can I do? Is there hope that they are curable? Is it something that I'm going to live with for lifelong? Oh no. Yes, there is a lot of treatment available for fibroids. You're not going to live lifelong with fibroids if you seek medical attention. Whilst I'm there, actually, Pastor Chooks, I feel I must bring it to the attention of our viewers and listeners that that is where your checkups come into place. The reason why we encourage ladies to do checkups at least once a year, it is so that if there are new developments in the body, they are picked up on time and management is done whilst it is still at an early stage, where we can institute conservative management, or if we do need to institute a little bit more radical management, but we still preserve fertility and we still preserve the functioning of the woman. So now, what is the treatment that can be done? Like good students of my class, you know that I always like to make things very, very simple. There's always 3 ways we can manage things. We can do nothing, which is expectant management, where we just keep on observing. 2, we can be conservative. Conservative means that we are giving you medical treatment and monitoring the severity, monitoring your response. Number 4, it is invasive or surgical management in our case. So surgical management can involve cutting minimally or cutting wide open cuts. And then the last one is radiological intervention. Let's dive into each one of them and see what does each one mean and when do we do that. Number 1, for the expectant management, let me make an example. It's a 23-year-old lady. She's not married. She's not planning to get married anytime soon. Mommy encourages her. Now you're a big girl. Please go and do your checkups. When she comes for the checkup, I find that there is a fibroid. For that little girl, all I'm going to ask, do you have any symptoms? Is it bothering you in any way? Most likely she will say no, because mommy just asked me to come and have a checkup. So for that person, all we do is let's stick to yearly checkups and monitor your symptoms if there are any new developments, and then at the rightful time, when something needs to be done, then we can take. So now that we know that there is nothing bothersome for this little girl, then we just observe it. That is expectant management. We are very lucky that as Amazing Power of Woman, we will be having a session of Ask and Answer. That is going to help us now dive into details before you see your gynae, of course, so that we have a broader understanding of what we mean with each. Then the conservative form, that one applies to a lady. Say she knows I've got fibroids, and I know that the fibroids can affect my fertility. I do not have any symptoms. I'm not bleeding heavy or having any pains, but I know that my fibroids are there. Then for that lady, we can choose, okay, to stop them from growing bigger, let's rather use some hormone manipulation like the depot injection to shrink them. But even in that case, we are not operating. Or say, you say as a lady, you know what, Dr. Gamete, these fibroids are bothering me, but I'm scared. I'm not in the right space to make a decision about them, or I still need to consult with my parents, or I need to consult with my partner. In that way, we say, what is your dominant symptom? If the dominant symptom is pain, let's control the pain. If the dominant symptom is constipation, let's do something that will relieve your constipation. If your dominant symptom is heavy bleeding, let's rather manipulate your system such that the bleeding is under control. So that is what conservative or medical treatment will do. In some ladies, let me make an example of somebody who is in their 40s approaching their 50s. We know that fibroids do get better when you approach menopause. So what we do is we give injection that will suspend the bleeding, or that will suspend the cycle for a while until you transit gracefully into menopause. Conservative management is very nice. It actually gives you time. It buys time whilst you make, you clear your mind, or whilst you raise finances, if there's finances, or whilst you wait for a readily available slot where you can be assisted. Then surgical management. Surgical management, like I have said, involves cutting now to literally take out the fibroids. We can cut to take out the fibroids. We can cut to take out the entire womb. This is achieved in various forms. There is what we call endoscopic surgery, which is laparoscopy, where it's just small fibroids that can be taken out or large enough to be crushed out as they are exited out of your body. The other form is when we cut open, like when we take out a baby, deliver the fibroids one by one. I like to use the word scoop them out, because we just scoop them out one by one, and then we sew the womb back. In that way, the symptoms of the fibroids are controlled. There is one area that I want to highlight about the surgical management. What we like to have in mind is your desire for reproductive health. So if you do not have babies, any surgeon who puts a knife on you or who goes for surgery with you must have it in mind that that womb must be able to carry babies. So damage to the fallopian tubes needs to be taken care of so that you can be able to fall pregnant spontaneously. But in cases where the overall setup inside is completely distorted, in that way we need to advise for trying to fall pregnant outside or with assisted reproduction. And then, so we can scoop up the fibroid. That is called myomectomy. I love you, my viewers and listeners, because you are so well versed with these procedures. So I am so looking forward to my question and answer session, where we will have actually an interactive session about how we can treat ourselves of fibroids. And then the last mode under surgery is the actual taking out of the womb. So I've seen ladies coming to me and saying that my gynae or my healthcare provider has suggested that I take out the womb. Let me be honest and say, it is always at the discretion of both the patient, which is you in this case, and your healthcare provider about what needs to be done. In modern healthcare, we do not impose on our patient what needs to be done, but we always discuss what will best suit your needs and what will best give us a good outcome. So please do not be pushed into a corner to say you need to take out your womb. Sometimes patients feel like, but the doctor will ignore me if I don't agree to what she wants. You have an option and you have a chance also to seek a second opinion. Okay, let me park there so that I make it very interesting for our question and answer session. Then the last method of treatment is radiological. The consumption is still upcoming in our South African setup, but yes, it is available. Number one, there is a procedure that is called the HIFU. HIFU is it's a high resonance ultrasound waves that are used they direct them over the fibroid, and then it gets its structure sort of gets crushed. I'll put it like that blatantly. I'm not gonna get into the technicalities. So that is available, but also it's about the size, it's about the position of the fibroid. Though the procedure of HIFU does not take out the fibroid, the intention is to shrink it over time. So once it's been crushed in its structure, then it will be able to not to take from the blood vessels surrounding it. When it doesn't do that, it will stop growing. That's how I can grossly put it. Then the second one is embolization. So it's called uterine fibroid embolization. With that, the radiologist tracks the blood flow to the fibroid and then blocks it with small micro beads. So those beads stop the blood flow to the fibroid, and hence the fibroid starves and it shrinks. So that procedure as well, that procedure as well does not take away the fibroid. It shrinks over time. So how do I know which procedure suits my needs? I can tell you now. You can go through them one by one, step by step, in whatever order. It does not affect your outcome. The end result outcome. The important thing that you should know about approach to any of these interventions procedures is that it must be well discussed, well deliberated, so that you make an informed choice as a child of God or as an amazing woman. Then how do fibroids actually complicate? If I get to a doctor and the doctor said your fibroids are complicated or your life is complicated by fibroids, number one, we spoke of heavy bleeding. That can result in anemia. There's ladies who have never had their hemoglobin above 9, above 8. You are constantly fatigued, you're constantly irritated, you're constantly feeling drained. You don't know whether is it work, is it because you don't sleep a lot, is it children? Anemia. Anemia of blood loss is a common complication of fibroids. Number two, it can be pressure symptoms. The pressure, if it's coming from the top to the bottom, you can have the actual womb coming out. We call that prolapse. We can have the actual fibroid coming out. It is called prolapse. You can have constipation because of the weight on your rectum. You can have inability to hold your pee because of pressure on your bladder. You can have recurrent bladder infections because sometimes you find that the position of the fibroid makes a ball and a socket on your bladder. So as you are emptying your bladder, the fibroid rolls and then it changes the angle at which the bladder is supposed to empty itself. When that effect happens, you find that you've got a lot of bladder volume that you keep after you've passed water. That result in recurrent urinary tract infections. Then you can also have what we call infertility or difficulty falling pregnant, simply because the fibroids are either taking the space where the baby is supposed to sit, or they are blocking your tubes, so you cannot have the sperms, you cannot have the egg moving in the space. Also, if they share the space where the baby is supposed to sleep, you can have what we call recurrent miscarriages. If you survive the recurrent miscarriages, you can go up and have what we call preterm deliveries, because as soon as the baby grows bigger, the fibroid also is growing bigger, and they start pushing and sharing and competing for the space. So that is one of the horrible, horrible side effects or complications of fibroids. And some people think that fibroids are cancerous. No. By definition, they are just non-cancerous tumors or growth. So we have a small percentage of fibroids that can change and become cancerous. Some literature put it in 1 in 500 women with fibroids will have them becoming cancerous, but that change is very, very rare. To those whom it happens, it is associated with the size of their bodies. So, but oftentimes I can qualify and say fibroids are not meant to be cancerous. Can fibroids move from one position to the other? I have said that yes, we can have an entity of ectopic fibroids, but they will still be within the sphere of your tummy, and either they lose the blood supply from the womb and they get carried away with the blood supply of your intestines. Remember, intestines are forever moving inside the tummy. That can result in ectopic fibroids, but still the treatment of those fibroids is the same. So can I summarize so that I still look forward to our discussion? If I tell you everything now, you won't answer me, ask questions from me, and you won't be willing to meet with me when we have our open question and answer session. So in my summary, I'm gonna say fibroids are very common, and they are a threat to our fertility. They are a threat to the life of women in general. And also, fibroids are a curable occurrence. If we pick them up on time, we can treat them without leaving significant markers on your body that you had fibroids. If they are big enough or too big, according to your definition, although I don't think there's fibroids too big to be cured, there is still something that can be done. If you have fibroids and you are scared of going to seek medical attention because somebody has said that your womb will be taken out, can I say, please make time, come see us so that we can assist you. We have the number on the screen where you can contact us, and you'll get the details on how to get hold of Dr. Gamedze, who is the gynecologist speaking to you now. Then we will be able to assess and find out which method of treatment will suit your needs. So in your list of intervention, take removal of the womb to be last at the bottom of your list. To the amazing women, we are empowered. Let's call it an empowerment. The amazing power of the woman, fibroids can be cured. Pastor Chooks will come in one day and discuss with you what is the spirituality around this. Is it the heel that was said the serpent must found? And how do we as women find the head and hit the serpent? God bless you.
The Power of Woman Academy.
Thank you so much, Dr. Gugu Gamedze, for such an insightful teaching. You know, I am blown away every time that Dr. Gamedze just teaches this stuff. You know, we are so grateful to God for you, Dr. Gamedze. You know your stuff. Ladies out there, you have heard, she has demystified this thing called fibroids. We are going to have a session, a question and answer session, and a prayer session. Obviously, there is a spiritual side to this. I mean, we are all Christians, and we know that things don't manifest in the natural if there is no spiritual, correspondence. So for us to terminate things in the natural, we terminate it in the spirit. The Bible says that when you pull out a tree, it dies. So in the spirit, we pull out things. And we're creating a session on Saturday, the 27th of March, to deal with that fibroid issue. Can you see the picture of fibroids there, right? And it's going to be a Zoom session. I don't like that thing. And whether you've had it, or someone that had it, you want to register for this session. It's a free session. It's going to be on Zoom, and it's going to be a question and answer session. Dr. Gamedze, like she promised, she's going to come on Saturday to answer questions, and then we're going to pray. I'm going to pray. We're going to release the fire of God and the power of God to deal with every fibroid issue. See, there are medical solutions to fibroid. But before there are medical solutions, there are spiritual solutions. And spiritual solutions are much cheaper and less stressful than medical solutions. So we're going to be praying on Zoom on Saturday, and we're going to be dealing with this fibroid issue. So if you do have questions, if you enjoyed the show, send the link of the show to another lady, some sisters around you, some aunties, some nieces, some colleagues, some friends. Every woman needs to know about fibroids and know how to deal with it. And then on Saturday, we're going to be dealing with it in the place of prayer. And we're going to be answering questions. Dr. Gamedze is going to be answering questions. But it's a Zoom meeting, like we said. The details can only be sent to you if you register. It's a free session. The details are there, bit.ly/AYG2021 2021. Or you can send a WhatsApp message to +27814210835. And we will send you the details for login to the Zoom meeting. It's going to be 10 a.m. prompt on Saturday. And hopefully in 30 minutes to 1 hour, we will be done. By the grace of God, we will be silencing the voice of fibroid in your womb. Wherever it is talking, whether it's talking loud or it's talking gently, it's shouting, it's whispering, we're going to be silencing that voice on Saturday. So come with your questions. If you do have questions from the things you heard today, come with it on Saturday, and Dr. Gamedze will be dealing with it, and then we're going to be praying and calling down the help of God, the hand of God, the fire of God to consume that which is not planted by God. God is not the one who plants fibroids. So we're going to deal with it in the place of prayer. I'll see you on Saturday. Register +27814210835. That's the WhatsApp number, or you can click on the link bit.ly/AYG2021. That's it. And we'll see you on Saturday for an awesome time via Zoom. God bless you. Thank you for hanging with us for another edition of our Amazing Power of Women broadcast. We look forward to seeing you next time. Good night.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za, or for inquiries, call 064 200 1544.